What's going on, guys? Dr. Andrew Fix back for another episode here on the Code. And for the first time here in 2025, it's Tuesday, the 14th of January, as of the recording of this. The first interview that we've got lined up for you guys here in 2025. And I'm joined by Chris Peng. He's the CEO and co-founder of a company called Labfront. Ultimately, they're a research solution trying to figure out how we can utilize a lot of this continuous data that we're capturing. They work with places like Stanford, Harvard, MIT, big institutions that you've heard of. And we're trying to find ways that we can use this data to optimize human performance, fight diseases. We were just talking off the air about things like different cancers and how we can use some of this data to improve those and ultimately move our human race forward. And this is kind of cool. We're on totally different sides of the globe right now having this conversation. So, Chris, thank you so much for getting up early and joining me on this podcast.
Thanks, Andrew. It's a pleasure.
And all you guys that are tuning in to listen, wherever you are, however you're listening to this, really appreciate your time. And Chris, can you just do us all a favor, all the folks listening, just give us a little bit better of an introduction. Tell us a little bit more about you, what you were doing, and how did you get into the position you are now, co-founding Labfront and helping to run that organization.
Yeah, so this story actually starts back in high school. My dad ran a lab at Harvard Medical School called the Center for Dynamical Biomarkers. And I spent a lot of time throughout high school and college summers as a research intern and research student in various different research labs across the Harvard network. So at Brigham or at Beth Israel, Mass General. And what I really noticed is, you have some of the smartest people in the world, working at these labs, the PhDs, the professors, but they're working and utilizing tools that are so outdated and really, really inefficient. And later on in my career, when I came back and thinking about how do I want to make an impact in the healthcare space. I think your audience here all knows they definitely have their issues with the healthcare system. How do we make a difference in that? Healthcare itself, it seems so hard to kind of approach directly. Um, our thoughts came to, well, if we can help to fundamentally affect the foundation layer, which is the research infrastructure that helps dictate what medicine will teach and medicine will do in practice, that would be able to kind of attack it at the root and then trickle up into the system itself. So that's kind of how we got started into it. We started building better tools for research, and kind of before the COVID hit, we were already in this space of remote research, remote data collection, continuous data collection, all those things that before COVID, basically no one really thought about. But since COVID and since the shift towards remote and the remote revolution, I think everyone's kind of starting to understand how valuable it is to not just collect one data point, bring people into the hospital one time, collect a data point, but to actually have continuous data points, especially when they're at home in a real world setting to get better information.
Yeah, man, there's so much that I'd love to unpack there because I really like what you said about, you were interning and working your summers and things in these labs and finding inefficiencies and finding problems with the way that the system was set up. And you were starting to figure out, trying to come up with solutions to these problems, like how can we perform this better? And just like our practice here at Physio Room and like the way that we try to approach things in our space from a physical therapy standpoint is, we don't want to treat symptoms. We want to treat the root cause of those symptoms. And I like what you said about, sometimes trying to make these changes in medicine and whatnot, it seems so hard to do. But if I can approach this, or if we can approach this from the research standpoint, that's going to drive the changes in the direction and trajectory that medicine teaches and goes. Man, I love that root cause mindset right there. But then something you just ended with of saying like the way that we approach medicine now, a lot of times is like a single data point leads to treatment, right? That kicks off a cascade of we collected this one piece of data, then we do this, and then we do this. If you could, let's just open that up a little bit more and let's touch on that of maybe explain that in a little bit more depth, and then we can talk about how if we have more data points or in a continuous fashion, like these different wearable devices, and maybe we can start to talk about like what some of those are, common ones that people might have. But let's go down that pathway a little bit.
Yeah, so if you imagine like you're watching a sports team, right? If you take one snapshot of the team and you try to figure out how that team interacts and how that team plays, it's actually really hard. It's one, you watch one highlight video that really doesn't represent how the actual team handles different situations. Unfortunately, the current medical system and the way that we practice medicine, built around the constraints that existed in the past, really, that's basically how you do it, right? You go into the doctor's office, you take one blood pressure monitor, you maybe do a blood test, you do a couple things, but essentially it's one data point. And as much as that data point is helpful to bring some context, there's a much more multi-layered depth of context that can exist. However, the current medical system is of no fault of their own, but the current, basically the research side has not caught up to start doing the and understanding this type of data. And there's a lot of things that we're starting to realize, that the body is that is a fully consistently in a dynamic state. And so, it's always changing. So when you do a blood pressure monitor, wear that cuff one time, there's a realization and understanding that actually the blood pressure actually changes, right? And the blood pressure is supposed to change. And so if I ran into because I was late for my appointment and I ran and I had some kind of somewhat strenuous activity and, ran up the stairs to get to the doctor's office, my blood pressure is going to be high, and that's supposed to be high because where the body is reacting to a stress stimuli, and it's operating and it's how it's supposed to be. But then if we take that measurement immediately or even within a few minutes, I'm going to get a high blood pressure reading, and I might be put on medication for lowering my blood pressure, where my blood pressure is actually, reacting in the way it's supposed to. So these things are important. But I would have to say that there hasn't been, the data and the research actually to do this. And that's actually part of why we built Labfront, is that we realized that this is extremely important, but it just even having the tooling to kind of collect this information and see it in a context doesn't exist right now. So that's why we starting to build now.
Yeah, I like that example too, because I bet you myself and many of the people listening to this probably have gone through that scenario where, they walk into their physician's office or urgent care or something and they get their blood pressure taken and it's higher than what they were expecting, but maybe they were rushing in there. Maybe they were, even if they weren't physically rushing in there, maybe they're stressed and they're like, oh man, I'm running late for this appointment. Maybe you're not sitting down, resting for a while before that actually gets taken. And yeah, it reads much different at different times of the day or different situations. So, and then like you said, you get prescribed a medication instead of, okay, let's try to figure out why you have high blood pressure or if you even have it and address those things, rather than just prescribing you something. Well, before we go too far down talking about like, okay, how do we collect this data? What do we do with the numbers and the information that we get? Um, Many of the people listening to this probably are already utilizing and wearing these things. Like, what are some of the tools or some of the devices that you guys are collecting and capturing this information from?
Yeah, so we currently, of the partners that are official and announced so far, as of the recording, we have Garmin devices. So it works with everything from their wearable watches to the heart rate monitor, chest straps. They also have scale and a blood pressure monitor. On top of that, we work with Dexcom for continuous glucose on metabolic health, and then essentially all this stuff related to diabetes. And then we work with MoveSense, which is a heart rate monitor, and actigraphy, and IMU sensor. So it's a 9-axis IMU sensor to see like what kind of movement you have, and that can be either worn on the chest for the ECG functionality, or it can be, you can pair a bunch of devices. You can put one on each wrist, one on each leg, and you can see like different movements. So those are the primary devices that we work with right now, but we have a full list of devices coming in 2025.
Awesome, awesome. And yeah, I mean, I previously have lived in the Kansas City area, like right there by Garmin's like big facility. So I'm pretty familiar with their devices and have worn many of them myself. Probably one of the more popular ones out there. And like if you're somebody that's wearing one of these now, like like I had when I had a Garmin watch. I've got a different brand on now, but same thing. These devices give you so much information. You're getting all different types of scores and readings of heart rate and HRV and all these things, sleep metrics. Based on what you know now from the research that you guys are doing at Labfront, boiling that down to like the everyday person that is going about their day-to-day lives, going to work, exercising, taking care of their family. Um, how would you recommend that we try to like utilize and use this information to our benefit to try to move the needle forward in our own health and wellness?
Yeah, so I think it all comes down to figuring out your personal like health. Basically e- everyone has a everyone's reaction is slightly different. But knowing how everything affects you, that's the part I think that these wearable devices have a unique thing that they can provide. And so, how your sleep quality is and how different things affect that. I think those things are the key points to understand because unfortunately, this system, just like everything else, is not a one size fit all. And the as I mentioned before, the science and the research is still very, very, very new. And so there are concepts that we can already understand, and there's concepts that we can under see. And but at the same time, overall, it's very much like it's basically a lot of experimental stage. This is really the Wild West. And if you use a different device, you'll notice that there is, every device has a different way of measuring sleep because sleep is technically in these consumer devices it's not standardized. And even if they tried to standardize it with the PSG, we have to understand that the PSG, gold standard was invented, now well, almost, 80 years ago. And there's been a lot of changes in everything since then, and understanding and even itself, if you take PSG read by an expert technician, two different technicians only have around 80% overlap in terms of
Mhm.
marking the same things. So it's one of those things that the standard itself probably needs to be updated.
Yeah.
But of course, all these standards are really hard to update. So I think that this the devices, I think, have a possibility of helping us update a lot of these standards. But as of right now, for users that are using it yourself, it's really about how it affects you, and it's going to be probably very ineffective to try to bring this up with your doctor or someone else because it's not in their training, and honestly, the research is still out there.
Yeah, yeah, that's interesting. And I feel like, many people that are interested in this conversation, like you tend to gravitate towards other people that are too. So like, if you're a runner, you might gravitate towards a physician that's also a runner. And oh, if they happen to wear a Whoop strap on their wrist, oh, you might have something in common that you want to talk about, and you'll build a good rapport with that person. But it sort of sounds like you're saying, and I think we see this just from person to person with two people might do the exact same thing. You might be hanging out with the same person, go to bed at basically the same time, eat or drink similar foods, and the next day you'll wake up and your devices will read that you two have totally different scores and whatnot. So I was having a conversation with someone here in the office yesterday around the topic of alcohol consumption and how that might impact his sleep quality. And specifically, we were talking about at what time does he consume alcohol relative to when he goes to bed. But what you're saying basically is to use that as the example. If two people consume alcohol 2 hours before they go to bed, that might impact their individual sleep quality very different.
Completely. And I myself I suffer from that. Alcohol affects me quite a lot in terms of my sleep quality. And I can see that immediately in my data. And, I have friends that drink and, they seem to sleep fine. It's hard to tell because, but definitely these things are all personalized. And I think that's the key point is to understand how everything affects you.
Yeah, yeah, for sure. So, I think you really need to, take a look at that data probably in an experimental kind of way. Like if you utilize the logs and the journals and things that these different apps and devices have, you can start to see these trends. But also take a look at these things over larger snapshots of time and don't make big wholesale changes to how you take care of yourself on a day-to-day basis based off of like one day's worth of information. Look at these over months and quarters and years, to get a bigger picture of like, okay, how am I going to make these changes? Hmm. Yeah, that makes a lot of sense to me. What, are there any, as it relates to like health and fitness and whatnot, are there any like major trends that you guys are seeing, at Labfront as you're collecting all of this data from these different organizations that you work with?
So I think uh, basically a lot of these things have been around for a while. So I think you just mentioned Whoop and HRV. I think Whoop has done an amazing job at marketing HRV and making it popular and mainstream. They're not the first ones to do that, but I think they're one of the more successful cases. But HRV has been around for, decades and decades. Actually, the definitive guideline for HRV, the second revised vision guideline, was actually written. My dad was one of the co-authors of this in the space. So the lab that you mentioned, also the research that we do. So Labfront build the software for researchers. We also have an internal research and R&D research lab with PhDs and professors. And part of our collaboration is with the Center for Dynamical Biomarkers. And the idea of dynamical biomarkers is the understanding that the biomarkers that we look at are changing, and it's how these things change and how they interplay with each other that actually is the most important key point. It's not just looking at, oh, look, my blood pressure went up or something like that. It's actually like, okay, how did that, how was your heart rate and your blood pressure and your respiration? Are those things coupled together? Because that's where we see like, okay, this is a positive physical response. This is a way of an adaptive movement. And so, one of the more interesting concepts that we've been seeing, and I think this will be probably, your audience will probably be able to recognize this, is that in the medicine that we have right now, in modern medicine, we don't really have a very good definition of healthy. So if you're trying to define what is a healthy state, it's really hard to kind of say what healthy is. We have infinite definitions of disease states, right? But lack of disease is not healthy per se, right? And that's something that I think is really important because essentially that's the kind of the way that we kind of treat everything in currently in medicine. And so my dad's lab at CDB, at Center of Dynamical Biomarkers, they kind of came up with a new definition of what healthiness is, and in our definition, healthiness is resilience. So it could be anything like physical stimuli, right? You're going to have to run up these stairs. And then once you run up these stairs, it's a real world setting. You're being chased by, I don't know, chased by probably not a bear. You probably, it doesn't matter. You've gone if you're chased by a bear, but you're chased by some animal. You have to run up the stairs. Okay. How does that affect you, right? Is that like, okay, huge stimuli, heart attack because your body's not there, or okay, I'm like wheezing a little bit, but I'm like, all right, after a few minutes, I'm back, right? Or is that other kinds of stimuli, like your boss yells at you and you're stressed out, and how does that affect you? So we look at it across different layers, and there that response, how the body responds to it's like the mental, the physical, that combination, that is what we kind of define as what healthiness is the better your ability to adapt to these situations, the more healthy you are.
Oof, man, I love what you just said there. I forget when it was on this podcast. Honestly, at this moment, I forget if it was an interview episode or if it was a solo one. But I was having a conversation about this similar topic, and that the absence of disease, like the absence of a problem, does not mean that you are healthy. It just means that you're in the middle of the spectrum, right? If we've got this spectrum of like unhealthy and disease state is over here, normal is in the middle, and wellness is on the other end. Absence of disease is like smack dab in the middle. That doesn't mean you're living well and you're thriving at all these different areas of life. And I like the word resilience that you used because, like, can you tolerate something well? Are you resilient to it physically, mentally, emotionally, socially? And I think, if you think about yourselves, like we all probably have different levels of resilience of these different buckets, right? Like you might be very physically resilient to something. You might be well trained. You might be able to do all different types of physical activity, and and viewed as the person in your social circle that is like, wow, they're the fit one of the group. But that doesn't mean that they're very emotionally resilient. That doesn't mean that they don't fly off the handle with their kids or something like that, and they let their emotions get the best of them. And in an ideal world, we would all be pretty far in the resilience category in all of these different buckets and fairly well balanced in all of those, knowing that it'll be really hard to be 100% in all of those at any given point in time. That would be pretty unrealistic, but something to strive for nonetheless. Um, yeah, I like that. We sometimes say here, I chuckle because I will tell clients like, this is kind of like a joke, but it's not a joke. We're trying to help create harder to kill human beings, and the word resilience fits right in that perfectly. Like we're trying to make sure you can withstand all the things that you want to be able to do when we get a chance to work with you. Let's take just a brief step back, Chris, and you know, you're coming at this from the research angle. You spent a lot of years in the labs and whatnot. You're working with these institutions. I think we already know, and the people listening to this know, that the way that we operate from a medical standpoint, at least here in the United States and many other industrialized places, is broken. That's the reason Physio Room exists. That's the reason other places exist. That's one of the reasons we're having this conversation is we're trying to find a better way to approach things and a better way to do things. But at the end of the day, a lot of this information, what goes into the medical system, comes from the academic side of things first and what gets taught and then what gets rolled out to actually do in real life. And I think you and I were talking off air that that side of things is broken too. Like how things get chosen for what's going to be funded and what's not going to be funded. Can you just sort of speak to that just a little bit of how do things get chosen and what gets funded now versus probably how we should choose and decide what we're going to research and what we're going to teach going forward?
Yeah, definitely. Happy to kind of explain this. I'm sure that some people in your audience have some idea, but for those that don't have any idea about the research space and how research is done and conducted and funded, to understand, one of the really important points is that the majority of academic researchers in America that are work, a professor at Stanford or a professor at Harvard in like Harvard Medical School, um, if they aren't teaching, they're what you call a soft salary position. If they're teaching, they get paid for teaching. But if they're not teaching, they're considered soft salary, which means that they actually don't actually get money or any salary from the institution directly. They need to fundraise their own salary from grants and other places, and then the institution takes a cut of it, and then the institute pays them, after they take their cut. And so there's a very real existential, not existential, real, a very real pressure of, where you get your next funding and how you kind of like keep your job basically. Because if you don't have money to pay yourself, you don't have money at all. You don't have a job. So, uh, on top, you layer that pressure on top of where the funding sources are coming from, and the fact that researchers, unfortunately, in the current way of doing research and the way the system works, are unable to really generate revenue by themselves. So it's not like they can, they build a product and eventually that thing is being used, and then, they can make money from it. It's the continuous process of always continuously asking for different grants to fund their research. And there's really two main sources of research funding. One would be the NIH or other types of public funding sources. And the public funding sources, of course, they try to do a lot of things and be a meritocracy. But if you don't need to dig very far to find out, it really is a network game, like who you know. And there have been some actions to try to fix it, of course, but at the end of the day, it is really difficult. And there's also a lot of risk aversion within decision making because it can become a political issue, right? Like you could have a politician talking about, oh, we wasted like $1 million on this butterfly study or something like that, and it could be pulled out and used as a political statement about wasting money in these spaces. But we don't know if that, potentially that butterfly study could have been something that leads to some kind of other cure that would be super beneficial. And looking at a small context like that is not very helpful. But unfortunately, that does dictate and that does help, unfortunately, influence how they make their decisions. So most science funding in the private in the public space is pretty conservative. They want to make sure they fund things that essentially have already been funded before, so that they really can't go wrong with it. And that means that you kind of get more of the same. And that's kind of what we're seeing in the stagnation of our improvements. Is that we get incremental improvements, but we're not really getting big breakthroughs. And on the other side, you have the private, funding sources, which are corporations and, medical device companies, pharmaceutical companies. And, they're profit-driven organizations and, that we don't, blame them for that. But it does mean that the things that they want to research and look at, majority are things that they already own patents to or can patent. And if you have something like the work that you're doing in PhysioRoom, it might not be patentable. And then there'd be very limited research funding that goes into something like that. So essentially, that's where the issues are coming from in terms of where the research decision making is be able to made. And at Labfront, I think what we're trying to do is kind of flip that on its head. If we can significantly reduce the cost of doing research, so that potentially you don't need these large grants to do research. If we can help basically provide an income source for researchers for the research that they do, then we can essentially unlock these experts and let them decide what they think is the most important thing rather than let bureaucrats or let large corporations decide for us.
Mm. Yeah, I like that because kind of like you said, if it's on the public side of things, they don't want to create too big of waves and you get more of the same. They take small risks. But on the private side of things, well, there's probably an agenda that we're working towards, right? We're trying to get the message out that we want to get out to the public's eyes and ears. So yeah, that kind of gets us stuck. I mean, it kind of reminds me in a way, it's different, but it reminds me in a way of like a lot of the nutritional research and whatnot's out there. And we find that like big corporations that manufacture food that we all know is unhealthy for us are behind the results of studies and provided a huge amount of funding towards the outcome of something. And it's like, we get data and claims that support stuff that makes no sense when you actually read the finer details of some of these outcomes and whatnot. So,
And they dictate public policy, right? I think you grew up with we're in the same. I think we're close enough in age. We grew up with the same food pyramid, which we kind of realize is not the pyramid that we want to use in terms of how we decide what we eat, and that has dictated school lunches for how long, right? So these things really are pervasive.
yeah, yeah. And at the end of the day, speaking of like a pyramid, it all comes down to this type of information, like what comes out of research, who paid for it, and then that's going to drive all of the decisions that may get made in all the different facets. Yeah, you're totally right. And it's amazing when you think about that, just like on the food side of things, it's like, what we were doing 20 years ago, or what I was doing 10 years ago is totally the opposite of what I'm doing now. And we feel better now following different information. So I guess the question is, and this is a very broad question, and you've started to talk about it, like, so where do we go from here as the everyday person? Where do we go? How do we take the next step forward tomorrow or next week when we wake up?
Yeah, I think a really important note to have and a more important way to think about things is like science is really important, but it's a dynamic, it's like a living thing. It's like, oh, this is the science. If you like that, I really feel that that is a very unhealthy way of looking at, oh, the science says this, and in a definitive way. Because almost never does a science say anything in a very definitive way, especially if it's early science, of course. Like, you talk about gravity and the theory of gravity. Yes, it's a theory, but it's been proven, again and again and again. That's very different than, okay, we had one study that showed this thing, or we have five studies that showed this thing.
Yeah.
And the problem that we're seeing is that, that we get separated into, oh, well, science says this, and then science says something different. And then we're like, oh, now we don't trust science. But I would have to say, like, no, that's why we trust science, because science learns from the process and figures things out. And yes, it can be originally, influenced by a lot of, corporations and their funding. Definitely, 100%. It is. It can be. But over the long term, the truth does win out. But just to note that it's, there are a lot of details within these papers that you have to read the fine details in, and they might not be reported when you see the big, headline news article saying that this XYZ is good for you or XYZ is the worst diet you could ever have. It's like those things, there's a lot of nuance that is missing. So I think for everyone to look at it is like we should trust the scientific process, but the scientific process is something that's long tail, right? In the very beginning, the breakthroughs, the things that are sexy, the things that are like really eye-catching aren't necessarily the things that you want to, immediately believe or just to say like this is for sure. Because the really it's a continuous process,
Yeah.
and there's a lot of things in there as well that we're working on to make, for example, replication more easy to be done, right? Because if without better replication, there sometimes can be academic fraud or dishonesties that don't get caught for decades, and that's something that's really important. So I think for everyone that's listening, it's not to say don't trust science. Definitely trust, like, science is there trying to do its best, but it works within constraints that incentivize that have different incentives necessarily than always providing the most truthful response to everything.
Yeah, yeah. Don't trust just the clickbait headlines that you find online to be your guiding North Star. But also, this is like perfect timing for you to say this. I was just like we all do. I was scrolling through my phone yesterday, and a former coworker of mine had something posted, and it was right along this topic. It basically said something to the effect of like, you know, science can change its mind, and that doesn't mean that it was wrong before. It just means that it's learning new information. And based off of that new information, science is changing its mind and it's changing its viewpoint on things because more information has come to light. And that's basically what you exactly just said is things can change as we find and uncover more and more information. And we should all be open-minded to move forward in our mind of like what we thought we used to know and thought was set in stone before can change as we uncover more data and more information. So I think that's a huge point. And I think I can relate to that honestly, probably even more now than I used to, just simply because of the last 10 and a half months I've been a dad. And what we're teaching our son now might be very different than what we teach him 20 years from now as our world changes and whatnot. So we've got to be open-minded if we want to pass that on down to our kiddos. Um, Chris, do you find, I would imagine you wear one of these devices with all the data that's being captured out there. Do you find accessibility at all being like a limiting factor? Like if the step forward that we want to take is that everybody has access to the most individualized and advanced healthcare option that we have, right? And that everyone in the future is there's a way that we can use this continuous data to help make smarter decisions to improve their health and not just try to have a cookie cutter approach for everything. Do you find accessibility being an issue today?
I think right now, wearable devices, although we both have wearable devices, and maybe a lot of people in this audience also has wearable devices, it's not really something that is like, like your smartphone that everyone has, right? And and there's good reason to it. It's not I think the value to it in right now in terms of how to utilize this information still is one of those things where, your doctor won't be able to really, most of your doctors won't be able to really utilize this information. You look at yourself, it's like there's a lot of like learning curve in terms of figuring out what to actually do with this, right? And I can understand that completely in terms of like the value proposition currently at. Long term, that's where we kind of see everything heading, that the devices that we're wearing right now will start to have sensors already, right? So Apple patented, an in-ear, both I think temperature, but I was definitely sure there was some kind of PPG like blood flow, heart rate monitor into the AirPods, right? Now, I don't know if that's ever going to come out, but they did patent it. And then that's another thing where something that already exists can start to incorporate incorporate sensors. And we're seeing that with the reduction of cost in sensors. So I would think that the way that we move towards accessibility most likely will be in the space of like where the things around us start to be sensing, and there's now smart, everything, right? Refrigerators that are keeping track of the expiration dates of the different foods and the calorie counts. Like there's going to be lots of these things that kind of can do it passively, and I think that will probably be that will probably be where the breakthrough happens, where we're still, our Nest thermostat is capturing information about how the environment that we're sleeping in affects our sleep, and having those interfaces all kind of connect together. That's actually the foundation of what we're trying to build beyond research. Is Labfront is the initial tool, but our goals as an organization is to kind of solve or contribute to the solution of healthcare. But that requires a layer of connectivity and understanding across all devices. And what we see right now is, you have Garmin, a great company, Whoop, great company, Dexcom, these companies that have really, really good products in a very specific niche space, right?
Yeah.
But there's really no one connecting all the information together. And I
Mm.
think this is probably very similar to what the work that you guys do at Physio Room is like. You look at the big picture, not just look at like, oh, just how my arm is moving, right? It's like it's the full kinetic chain that affects everything. So I think it brings back to everything is that, unfortunately, yeah, I mean, I don't know, unfortunately or not, but it's very difficult to have this contextual understanding of everything. It happens just to be the specialty of the research that my father did, which dictates a lot of the work that we're working on right now and in the future. But that kind of interconnected layer to be able to see all these different things and how they affect different pieces, I think that will be the future, and that will be how we all kind of like move beyond this stage of like this kind of like sick care, treatment, symptom treatment kind of cycle.
Yeah, man, that would be amazing because, like you said, it's all interconnected. And I can't tell you how often, like probably every day, we're continuing to try to have that conversation with people about how and why we want to have this like whole broad picture approach. And, when somebody comes in with a host of symptoms that they're dealing with, and what they want is they just want their knee to feel better, why we can't just treat their knee. And sometimes they're like, well, why? I just need my knee to feel better so that I can run this half marathon. And I'm like, but it's more than just your knee, right? It's your sleep, and it's what you're putting in your body, and it's how you're managing your stress, and it's your hip, and it's your ankle, and it's the shoes you choose to put on. It's like all these things. It's not just as easy as make my knee feel better. So, sort of what you said is when we probably will get one of these breakthroughs is when the data is kind of captured around us, and like it doesn't rely as much on like what we are inputting, or what one person has this device but another person doesn't, but that it's like it's just integrated into our daily lifestyle so that we can make more decisions and collect data based off of the masses, instead of based off of just a small subset of the population. Because I think, like you and I, like I probably circulate in a social environment where the majority of my close friends and whatnot and family, like a lot of them have these things, but there's plenty of people I know that don't also. So it's like, well, we can't make decisions just based off of a couple people. We need more widespread data. So yeah, that makes a lot of sense to me. Chris, one more thing before we like start the process of kind of like winding this down, wrapping this conversation up is, what did you do before Labfront became a thing? Like, I didn't get a chance to ask you yet about this. Like you had a stint of time in Ethiopia, and like what were the things that you were doing before Labfront?
Yeah, so I went to college in Canada. I studied some electrical engineering, but with a lot of engineering majors, you kind of like realize you learn everything from a textbook, and I really wanted to see what was out there in the real world. So I actually took a gap year that ended up extending for forever. So I ended up dropping out. But I moved to Thailand to volunteer just to kind of see where, what's going on in the world. It's something that I've always kind of wanted to see. After from that experience, I learned a bunch of stuff about, just like the reality of the situation in different places and how fortunate I am to, have been born in America and never have to suffer a lot of these challenges that, the people I was working with did. And that kind of led me to wanting to make a bigger impact in the world, but in a more scalable way. Because as a volunteer, I was very replaceable in what I could do, but I also had this skill set of engineering technology and to figure out how do I merge those things together. So I ended up joined a tech company to kind of learn how to build stuff that can make it so that it could be more scalable, impactful. And during that time, my now co-founder, who's the current COO of our company, Jordan. He was a classmate of mine and a track and field teammate actually from in McGill, and he was living in Ethiopia. They were building one of the first emergency care hospitals in the country. Before that, most people had to be air evacuated out of the country if they had some kind of emergency surgery, which meant that it was very, very, very high mortality rates to kind of have to go through customs while you need to be like stabilized. So they built the hospital, they're in the process, and they realized that, because it's one of the first emergency care hospitals, emergency surgery, emergency care, there is actually no emergency services like ambulances, 911. So that didn't exist in Ethiopia because there was no need for it because they didn't have anywhere to send people. So once they did have that hospital, we needed to create something that could replicate that. And basically, because even in the capital, most streets don't actually have names. They exist on Google Maps, but they don't have names. So you can't use an address-based way to kind of figure out where people are. So we kind of had to figure out, utilize GPS coordination and other ways to, use our smartphones. That smartphone proliferation growing and growing, even everywhere. Use the GPS on this device to kind of build a, Uber for ambulances, if you may, but a much more small, commercialized, privatized fleet. So I worked on that. And then from there, we launched it. It was the first service in the country that offered this kind of thing. It operated for almost a decade until 2022, actually. Served over 10,000 people. But we were decided that, this thing itself was a really fun project that we work on. Could we do other things that have larger scale that can affect larger populations? And since, as I mentioned, I've been in healthcare and research and science for a long time, I reckon my dad's lab was fortunate enough to have a bunch of breakthroughs, including in the space of heart rate variability and other things like heart rate variability. And so recognizing that there's a lot of changes that will be happening in the future, and what we need to fix the systems that we have to have better healthcare for everyone. That's kind of where I started, and we eventually got to Labfront. So that's kind of how we got here.
Yeah, I love it. I love the passion behind the mission that you are going after and sort of the stories along the way. And now I'm curious, like everyone else might be that heard you say you had a track and field teammate. What things did you run or jump or compete in the track and field world?
Yeah, so I wasn't much of a runner for the sake of running. I had to do something, so there had to be something in front of me. So I used to play soccer, right? Chase a ball around, or then move that to track and field, jump over hurdles, jump over a high jump bar, a long jump, do something that wasn't just running. For me, it was more. I like to do a little bit more of the, different types of activity. I wasn't really someone that's an endurance athlete. Starting to find the appeal of that now, but back in the day, I was definitely trying to finish my race as soon as possible.
Yeah, the shorter the duration, the better. And yeah, some variety mixed in there with hurdles and barriers and whatnot. That makes sense to me. All right, Chris. Well, let's let you out of here on this. I know if you're tuning in and watching us on the YouTube recording of this, you can see on the screen there's some contact information in different ways that you can get in contact with Chris. But if you're listening to this, and you can't see that. Chris, if somebody wanted to follow up with you, they wanted to learn more about Labfront, they had questions after this episode, what's the best way for folks to get in contact with you, your team, or find you guys online?
Yeah, so if you have anyone that you know that's a researcher or something like that, the biggest help to be for them would, for us and for them, would be just let them know about Labfront because our tool is something very new and something that a lot of people right now, they still don't know about it. And as soon as they do know about it, it's a great tool for any type of human related research. So, it'd be great if anyone can let them know. And reach out to me. The best way would probably be by email. My email is the letter C at labfront.com.
All right, we'll be sure to include that in the show notes on here. And when this episode goes live, Chris, we'll get you all the things so you can spread that out to your network too. You guys that tuned in to listen to us on the code, thank you so much for your time. Um, Staying with us through this conversation to the end of the episode. And if this is your first time joining us, one, again, thank you. But if you've heard me say this before, because you've been here before, reviews go a really long way on this podcast. If you've never left us a review on whatever platform that you're tuning in on, that would be huge. Scroll down to that section, drop 5 stars on there, and you'll find all my contact information too. If you have questions or if you have topics that you would love to see interviews or episodes on, so that we can tackle those for you guys, please let me know. Otherwise, we'll catch you guys on the next episode of The Code. We'll see you later.